fact is we don't know what a healthy microbiome looks like. Each of these microbes would need really thorough scientific research to determine what a reference range is. And it just hasn't been done. So you can't just, measure a microbe and decide that between like 1 is bad and 10 is good. And the closer you get to 10 is better.
Okay. Hello, Andrea. Welcome to the show.
Hi, thanks for having me. I'm so excited to be having this conversation with you about, all of these GI tests and what works, what doesn't, what we should be saving our money on. So yeah, it'll be
Definitely. Good. Yeah, definitely. I know I asked my audience what would be interesting, and this was the top topic in terms of gut health tests, just to go through the most common ones that people talk about and what people should be focusing on and what they should probably skip and not waste their money on. So super excited. Just to introduce yourself, do you want to tell us a little bit more about you, where you're located, and who you help currently?
Sure. So I'm Andrea Hardy. I'm a registered dietitian. I have a Canada-wide private practice called Ignite Nutrition, where I have a team of amazing GI dietitians. I'm a psychologist to help people with GI disorders. And then in addition to that, I do a lot of media, speaking, and science communication through Instagram at Andrea Hardy RD. And my ultimate goal is really to help connect people with sound nutrition science, especially in the field of gastroenterology. I struggle with GI issues myself, and I just feel like a lot of times it's taboo, it's hard to talk about, and there's a lot of misinformation out there that we need to tackle as well.
Definitely. And I know you also help other practitioners as well, as I've been in your professional or your GI support supervision group.
Yeah, we do a lot through Gut Ed. It's just gut-ed.com. And we do help a lot of dietitians with continuing education. We have some amazing free resources. We have the Gut Ed guidebook, which is like, we are slowly adding a whole bunch of GI topics. I think we probably have like 8 or 9 GI topics that are fairly well-rounded in there right now. So SIBO, IBS, IBD, bile acid diarrhea, we kind of cover it all right now.
Yeah. And the monthly journal club as well.
Yes.
Recently.
I'm super excited for the next one. So
yeah. Awesome.
Yeah.
Cool. What got you into, I guess, digestive health and made you want to focus on this as a dietitian?
Right. My background really was actually working in acute care. So I spent a lot of time working in ICU, CV-ICU, liver transplant, all of which had significant overlap with GI. And then I worked in oncology. Again, significant overlap with GI because chemo, radiation, surgery all impact the GI tract for a lot of cancer patients. As I was working in the beginning of my career, I was struggling myself with irritable bowel syndrome. And I'm the type of person that needs to know everything about everything. So when I was diagnosed, I really dove into the research. And then my colleagues would come to me and ask me, this was like when the low FODMAP diet was just coming out, my thoughts on it, how I would implement it, all of these sorts of things. So I moved, and when I moved to a new city, instead of working in acute care, I started a private practice, knowing that there's so many people to help with GI. It was so underserved 10 years ago. Actually, it's my business's 10-year anniversary next week. So yeah, it's exciting. And so we've had 10 years of GI care and trying to get the message out about digestive disorders, which is really just, exploded the last 10 years. It's top of everybody's mind when it comes to health.
Yeah, definitely. Gut health is a very trendy topic these days. And as you said, a lot more research out there and good information, but a lot of misinformation too. So which we will dive in for today. So let's talk about gut health testing. So we have sort of 5 on our list, and I guess we'll just go through each of them. We can talk about what the tests do and sort of what conditions that they may test for, and then sort of our thoughts based on the current research and whether they're either underrated, so something you maybe should consider, or overrated, something maybe to skip or use with caution. So the first one we'll go through is IgG testing. So these are like the food sensitivity blood tests, I think is like the common term that people would maybe recognize them. I know here in Ontario, we have Life Labs. I've seen like posters for these tests in the lab. And then I think a lot of like naturopathic doctors recommend them. I haven't seen many dietitians, but essentially what they test for are IgG antibodies in the blood. And they claim to help you identify different food intolerances or sensitivities. So essentially, what are your thoughts on these tests? I know mine, but
Yeah, right. I'm sure we are of the same mind. But, IgE testing is not evidence-based. And here's why. So as we go through these tests, I think it's really important to have some context around tests that are offered outside of conventional medicine. Some have evidence, some have evidence that is poorly done. In the case of IgG testing, this is an example, and some completely lack evidence. But at the end of the day, you're paying money to try to find a solution to something you're struggling with. So I have so much empathy there. You're, probably have gone down the conventional medicine route and just either haven't been heard or feel like the solutions don't resonate with you or they haven't worked. And so it makes sense that you're seeking an answer. And a lot of times these tests overpromise. And this is definitely the case with IgG testing. It's saying, your digestive issues, your health issues, your fatigue, your, whatever, is because you have a food sensitivity that can't be diagnosed in a traditional manner. So pay us $500, we'll tell you what you can and can't eat, and we'll make you all better. So with the IgG testing, I think it's important to understand what IgG is, and it really is an antibody that is produced when the immune system responds. And so the immune system responds in two different ways. One is in a reactive way, in a defensive way, like we would see with IgE-mediated allergies. And then one is in a recognition kind of way. And the science is, a little bit out on IgG, but we know there's different types of IgG where some responds, reactively, and then where it responds to recognize. And it's really hard to tease that out, and it hasn't been validated that measuring IgG response is going to tell you what you're intolerant to versus what your immune system is recognizing. Because your immune system's kind of like, cataloging things as it comes in. It's like safe, unsafe, safe, unsafe. IgG is part of that recognition system. And so just simply producing IgG doesn't necessarily tell us what your immune system's actually doing. I think what's also important to recognize is that certain foods are more antigenic, meaning that they elicit a bigger immune response than other foods. And that's not necessarily a bad thing. Those antigenic foods are those top priority allergens. Wheat, dairy, soy, eggs, all are more antigenic. Your immune system is inherently going to, do a little bit more work in identifying those proteins. So you're going to get an IgG response. And so when patients bring me these readouts, of course, a lot of times the most antigenic foods are high because their immune system's like, hey, yeah, we recognize these. They're the foods you consume regularly, and we're recognizing them. But the way that these tests get interpreted is you eat these foods all the time. No wonder you're so sick. Just cut them out. You'll feel better. Mm-hmm. And so it's very validating for people to get the results and be like, oh, no wonder I'm so sick. These are such common foods. I eat them all the time. Mm-hmm. And so it's very easy to feel like this test is the right answer. Mm-hmm. When we cut out things like wheat, dairy, eggs, soy, what are we left with? We're left with exactly whole foods that you have to cook from scratch. It's going to be, typically a very simple diet. It's going to require you to overhaul your diet, put more attention into your diet. And inherently, people could feel better by doing this because they're overhauling their diet. They're choosing more whole foods that they're making from scratch. And it could have nothing to do with these tests at all. or the results of these tests at all. And of course, a lot of those foods inherently tend to be higher in FODMAPs when we're talking about dairy, wheat, and soy specifically. Some of the nuts and seeds, some of the legumes, more antigenic. So I do wonder, is cutting out those foods just reducing the overall FODMAP load for a lot of these people, resulting in symptom improvement?
Mm-hmm. Yeah, that's a good point too. And I think just the process of like using these tests, I think they're typically recommended to like, and say by a natural health practitioner to do the test, and then you cut out all the foods that it says you're sensitive for. I think they usually do like 4 weeks. You eliminate them, and then one by one you test them back in. That can be quite challenging if there's like 20 to 30 foods on that list. And I've had a lot of people who have gotten the test done, they kind of thought about it, and then they gave up on it because it's just too complicated and restrictive to even follow. So I think even from that approach too, it can be hard to actually like implement the results. And like you said too, is it, if they do end up implementing it, is it actually just your diet quality is improving? It's similar with like someone trying the paleo diet or Whole30, where they're eating like a lot more single ingredient, nutrient dense foods. So you're probably feeling better as a result of that and cutting out a lot of more, more processed foods in your diet. So it can be hard to tell what's actually helping in the situation. Mm-hmm. So, and do you need a $400 test to do that?
Right. And then, is there any fear about adding those foods back in? Because it certainly happens with any other elimination diet, is if you feel better cutting out those 20 to 30 foods, are you going to hesitate adding them back in and end up on an extremely unnecessarily restrictive diet that impacts your food relationship, impacts your social life, impacts, how you feed you and your family. So there's a lot of considerations there that I think are often missed when we look at implementing a restrictive diet to solve a health problem.
Yeah, that's a good point too. Even in the case of IBS, like, it's quite common for people to feel anxious just about eating. So if you're feeling nervous about eating a certain food, that can actually just impact the gut-brain connection, and in a sense can make you actually react to the food just because you're feeling more anxious or more nervous about having it. So whether it's the food or it's sort of what's going on in your body and you're just reacting in a sense, that can occur too once we, start blindly cutting out all these foods and, start worrying about every little thing that we eat, which is not a fun place to be in either. So
no. And it's not a fun place to be in, and also down, $400. So exactly. Save your money. And if you have the opportunity, work with a dietitian to figure out, what your symptoms are going or what's going on with your symptoms, and then evaluating like an actual strategic evidence-based plan to help resolve those. Sometimes nutrition's the answer, sometimes it's actually not. So having somebody really take a critical look at that can help you on the right path.
Yeah, exactly. And with I think the other issue too is with these tests is a lot of people say that they think that they're testing for allergies. I think there's like a common thing to sort of use allergy intolerance and sensitivity like interchangeably when they're actually different. So allergy is an IgE modulated reaction, which refers to like an actual allergy, and that one is an immune response, versus a food intolerance could be IgG, but it's actually a response of like your digestive tract. So either you lack an enzyme to break down a certain food, like in the case of lactose intolerance, you lack lactase enzyme, then you may get bloating, gas, etc. when you consume like milk or yogurt. But it's not an immune mediated response. Although you said like the IgG can like be more antigenic to the immune system, but it's not like an immune response. I get a little bit tripped up in the science there, but
yeah. For sure. And I mean, ultimately, when it comes to food intolerances and sensitivities, there's so much we need to learn. And there's a lot that's poorly understood, and we need to be careful about predatory tests that profit off of pathologizing what might be a normal immune response. So I have people that have noted they feel better on their, restrictive IgG supported diet. And when we get into it, we realize, you've cut out a lot of FODMAPs and maybe fructans is actually the
Mm.
problem. Or your diet quality has changed, or how frequently you eat has changed, or how you prepare your food has changed. So there's so many other factors that might lead to you feeling better that could be considered to reduce how restrictive the diet is.
Yeah, exactly. And it could be hard to backtrack a little bit from that. I think once you've cut out so many foods, like you said, then people can be anxious to add them back in. But as we would say from a whole, maybe skip these tests and work with a dietitian so that you can have a plan to identify what's going on without needing to be so restrictive, at least at the onset. Like some restriction
Mm-hmm.
may be necessary, like if there is, a suspected intolerance or allergy, but usually upfront, it's probably not where we would start with anyways for someone to cut out a bunch of foods. So yeah. I just want to say, even in the case of like intolerances, I guess if we think about like what may be driving the intolerances, there may be like an immune connection there. I was thinking about even in terms of like histamine intolerance, where we know it
Mm-hmm.
can either be caused by, is it DAO, like enzyme being low, which can occur from, I think, different like conditions, etc. Or there may be like sort of an overabundance of histamine production, I think, which can occur in like SIBO, which then there may be like an over activation of the immune system, but you're still like low in that sort of enzyme that helps break down histamine. So that all to say, I was trying to say that with an intolerance, it's not immune mediated, but there may be something deeper going on that like involves the immune system. Is that right? I don't know if I sort of explained
Yeah,
that clearly,
exactly.
but
That's exactly it. Is especially, post-COVID infections, we see mast cells behaving badly. So these are,
right.
the mast
Mm-hmm.
cells that house a lot of immune mediated chemicals. And when they release those immune mediated chemicals, they result in symptoms that are allergic like.
Mm-hmm.
Um, we know that people with IBS have a higher presence of mast cells in their GI tract that
Mm-hmm.
contributes to visceral hypersensitivity. We know that people with IBS tend to have a microbial profile that's more likely to cause excess histamine production in the gut.
Mm-hmm.
So, all this to say, you're right, intolerance may have an overlapping component with an immune mediated reaction.
Mm-hmm.
And I think, again, with this test, it hasn't been validated. They've tried poorly, I would say, to go back and, validate it with some studies that are well designed and kind of like already have a predetermined conclusion in mind. Like they don't go
Mm-hmm.
into the science experiment curious with a hypothesis. You can tell they've kind of gone in with like, I'm going to prove this test works because that's the goal of the study. So,
Right.
um,
It's not where we want to start with science.
no, exactly. So I think at this point, we can't measure your IgG response to dietary proteins or components or
Mm-hmm.
foods and use it in a diagnostic process because it hasn't
Mm-hmm.
been validated. We don't fully understand IgG and the different types of IgG, and we're not good at measuring those things. So skip it.
Yeah. And it would be amazing if we did have a blood test that could tell us all the foods that we were intolerant to. But yeah, as you said, the science just isn't there even in 2025. So hopefully at
Yeah.
some point, but for now, it's a pass. And then if someone were to be considering or wondering how do I actually understand or investigate my food intolerances, the gold standard that we still have is a structured elimination diet and then a reintroduction diet, which we suggest to do with a dietitian so that you can do it properly and know what to look for and be able to isolate or remove additional variables so that we're not conflicting the results
Mm-hmm.
as well.
Yeah.
Yeah, which low FODMAP diet is an example of that too. All right, so let's get into the GI map test as our second test.
Yeah.
So I like to talk about this one. I actually have a blog that I think I published it maybe 3 years ago, and it's definitely like the best performing blog on my website. And I get a lot of like positive emails around it, and then other people that I get some sort of angry emails about my statements in that article. But
Yeah.
yeah, it's definitely something that I have not recommended in practice. I've also never done it myself. I think it's a pass, but what are your thoughts on this
Yeah.
testing?
This one for me is a pass, or like pass, don't do it,
Mhm.
because similarly to IgG testing, the evidence just isn't there. So like I feel like as dietitians we can't have it both ways. We can't just use the science when it's convenient for us and ignore the
Mhm.
science when it doesn't serve us.
Mhm.
Unfortunately, we have to look at it all, even if it irritates us and you get crazy comments on your blog. So the ultimate thing is with the explosion in microbiome science. So GI map is a microbiome test where they measure a variety of different microbes in your stool, and they kind of like rate them in this like super pretty printout of,
Mhm.
too much, too little, the right amount. They also look at fecal elastase, which is a validated test that we'll get into. But there's a few other components of this test. I've seen physicians recommend it, I've seen dietitians recommend it. And I posted about it on Instagram the other day, and a dietitian had said, I respectfully disagree because this test has helped people.
Mhm.
That's not how science works. We need to validate the test
Mhm.
because a lot of times with GI diagnoses that are functional,
Mhm.
the trajectory is as people get better over time. So like we can't just treat people and be like, oh, it was the treatment that made them better. We need scientific evidence to tease out,
Mhm.
placebo effect, natural disease trajectory, all of
Mhm.
these sorts of things that result in improvement. So we can't just say like, oh, I did this and this person got better, therefore it must be valid. I always tell this story. One time I thought I got drunk because I drank 2 beers outside a soccer stadium, and it turns out they were non-alcoholic. Like our brains are really powerful things. About 30% of interventions in a study are, we get a 30% placebo response or
Mhm.
no SIBO response in the case of, my alcohol. But ultimately, we can't just go off of anecdote when
Yeah.
it comes to these tests. So,
Mhm.
GI map, it's really unfortunate because microbiome science is exciting,
Mhm.
but we haven't validated, clinical ranges for these microbes. So when we think of our gut microbiome, we want to think of it like a big forest with a whole bunch of trees and animals, and it's really an ecosystem.
Mhm.
And when we think of that ecosystem, there might be things that exist in that ecosystem that, if they got out of balance, might cause harm.
Mhm.
But in a functioning ecosystem could exist without actually causing any issues. For example, E. coli. You can have E. coli existing in your stool and it not be pathogenic or not cause disease. It's
Mhm.
when it gets out of, balance, and there's certain types of E. coli that you would get infection.
Mhm.
So the fact is we don't know what a healthy microbiome looks like. Each of these microbes would need really thorough scientific research to determine what a reference range is,
Mhm.
and it just hasn't been done.
Mhm.
So you can't just, measure a microbe and decide that between like, 1 is bad and 10 is good, and the closer you get to like, 10 is better. So
Mhm.
we don't have the research to really say that those numbers are meaningful and
Yeah.
that they represent a normal healthy gut. And then we certainly don't have data to say that if you do X, Y, and Z, if you take these supplements that I'm now selling you, these microbes are gonna, go away or improve or what have you.
Yeah. That's
So
the
yeah.
issue with the test too, is that I believe with the GI map, they come up with their own parameters. Like it's just based on their
Mm-hmm.
own numbers that they came up with in their own studies, which is a big red flag. Like if someone is selling a test to diagnose something, for them to come up with like just their own data and their own parameters around what is good and bad, is definitely a red flag for sure.
Mm-hmm.
And then yeah, to that point as well, I think like a lot of times people are told to take this again from like natural health practitioners, then they get the results back, and then they're given, prescriptions for hundreds or thousands of dollars of supplements to help fix the the issues that this test comes back with. But to your point, do we actually have the research that tells us, what is wrong? Like, what is the issue with your results? And then how do we fix that? We just don't have that data yet.
Mm-hmm.
So in a sense, people are still sort of guessing on how to, treat the results from these tests too.
Exactly. And I mean, there's been like, I don't know if it was 60 Minutes or whatever, but ultimately someone I remember sent their GI sample to like 3 different of these microbiome, test studies, and all the results were different. Like the reality is your microbiome fluctuates day to day. What my microbiome looks like today is probably different than what it's going to look like tomorrow based on what I eat and everything else, going sleep, stress, all of these things. And even in this one sample, they got a whole variety of results because, there's human error involved. There's sample contamination. Like you're not in a lab doing the sample in a way that's structured. All of these companies are, hopefully following best practice, but we don't really know what that is. So, you might have a diagnosis with GI map one day, and then a week later, you might not actually meet their diagnostic criteria. It's too variable to use, unfortunately, right now as a tool to diagnose and treat. We don't have the data for diagnosis. We don't have the data for treatment. Again, we're pathologizing your stool when you're struggling, because you would do this test when you're struggling with something, whether that's, bloating or fatigue or diarrhea or what have you. And it can feel really validating to get this test. It can feel really validating to get solutions. And then you might get better based on those recommendations. So again, it's another source of validation that doesn't necessarily provide us like good clinical data.
Right.
Because you could have inherently gotten better over time. You could have made changes that would have gotten you better without doing these tests.
Yeah. And for those listening that haven't done or looked into the GI map test, essentially you put like a little hammock on your toilet and you poop into it, and then you mail it into the lab. So as you said, like it's a lot different doing it in the comfort of your own home versus in a lab where they're able to, keep things controlled and more sterile, et cetera, which can also impact the results. So various issues with this test. Also about you saying that it can change like day to day or week to week. I think also it's important to recognize like your stool won't look the same sort of throughout, like as it moves through your intestinal tract or your GI tract versus what you actually poop out. So what, the end result may not actually like match what it is sort of when it's still in your body, which is also an issue too, if we're using that for results.
Yeah, there's some really cool new science coming out, but it's literally, in the phase of exploration where they're able to sample the microbiome throughout your entire GI tract, which cool. is really cool. And I can see that, people are going to try to capitalize on this and, it's going to turn into like another GI map, but hopefully we can use that data.
It'll be AI powered as well.
Right. What this in. Yeah.
So we know it's not a validated test for IBS or SIBO, which we'll get more into the testing for SIBO. Candida, I think, is another one that people use to say it helped them identify that they had Candida overgrowth. But the issue with that one, like you said with E. coli, is that Candida also naturally exists in your intestinal tract. So just because you have presence of it in your stool or a certain amount doesn't necessarily mean that you have a Candida or fungal overgrowth. Right. So another issue with that one there. I was reading though the one, you mentioned fecal elastase and then also H. pylori. I wasn't too sure where I landed on that one. I saw some sources say it could be helpful to detect like presence of it, but what were your thoughts around H. pylori and the GI map?
Yeah, I need to re-look at it. I don't actually remember what they're measuring in the GI map around H. pylori, but we can use stool as a method of diagnosing H. pylori. Right. So they could be using the validated test. I wouldn't be surprised if they were. I assume they were if they, they are if they're, using things like fecal elastase.
Mm-hmm.
So it could be helpful in that case.
Mm-hmm.
My concern is like, who's prescribing you this test? Are
Mm-hmm.
they capable of diagnosing? Because I'm not. I'm a dietitian. I can't diagnose you with anything, but I can, advocate to your physician to take a medical look and make those decisions. Do you have a medical provider that can diagnose, that's overseeing the use of this test? Is a big question. You don't want to just be diagnosed willy-nilly by somebody who can't diagnose legally and shouldn't be diagnosing, doesn't have the skills to diagnose. So yeah, if you are using it for fecal elastase and H. pylori, one, why don't you do the cheaper individual tests? If you're living in the US, I'm sure it's much cheaper to do those separately than it is to do GI map. If it's in Canada, get it through a physician that can diagnose, as opposed to, paying for an entire GI map to do 2 validated tests. And frankly, like, it's very rare that I would ever suggest to a physician to do a fecal elastase and H. pylori at the same time, because the symptomology is so different. Like if you have H. pylori, or if I suspect you have H. pylori, I'm going to tell the doctor, this person has X, Y, and Z symptoms. Have they been tested for blah, 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 blah? If not, would you consider it? Fecal elastase, same thing.
Right.
Totally different set of symptoms that I would present to the physician and request a test. If they thought it was appropriate, they might move ahead.
Right. Yeah. So it would be better to do more targeted testing than just consider this GI map test that claims to look at everything, but really doesn't properly look at anything.
Because test sensitivity and specificity varies. Certain, like with the H. pylori stool testing, its sensitivity and specificity, I know it's lower, so it's not 100%. So they could falsely diagnose you with H. pylori, or they could miss diagnosing H. pylori. So we want to take it in the context of symptoms, not just willy-nilly test everything in everybody.
Yeah, exactly. It's a good point. And it makes me sad too when I see people like recommend it or they pay for this test before really trying anything else. Like even in the case of IBS, we know that it can be really well managed with dietary and lifestyle changes, which will get you a lot more results than doing a test and taking a bunch of supplements, which really just won't, kind of mask the actual issues there. So again, too, that's why it's
time to accurate diagnosis.
Right. Yeah, exactly. Too. So many issues with this test. Yeah, I'm not a fan. And I know I sent you the other day, like a very popular gut health dietitian who said it was one of the tests that every person with gut issues should run. But
yeah, I really struggle with that sentiment. It just doesn't make sense at this point.
Yeah, I think it's like anything. You can't really say that there's one thing that everyone should do. I mean, maybe drink more water, but then again, some people are already drinking lots of water, so maybe not everyone needs to drink
more.
Makes
like reflux worse for people.
Yeah.
I think as providers, because I assume dietitians listen to your podcast, we really need to address some of our own biases in, offering these tests, because we really want to help people. And so if this test is sold to you and you're not super confident in dissecting the science, you're like, this test could help my patient, why wouldn't I do it? And then they do present all this data that isn't, I've combed through it. It's not research. It's just, pieced together, again, cherry picking to validate, their particular stance on measuring each of these microbes. So I think sometimes we need to just take a step back and realize people want, people don't like the diagnosis of irritable bowel syndrome. They feel like it's not real. So they're looking for, these root causes, and this GI test can feel really validating when in fact it, is muddying the waters, overcomplicating things, and not necessarily providing people appropriate solutions to their symptoms, let alone, the results of these tests.
Yeah, that's a good point too. And even as you said, like with IBS, we know that the microbiome profile is a lot less diverse and less resilient. So probably if they were to do these tests, if you had IBS, it's going to show you that maybe there's low levels of your healthier bacteria, but do we need like an $800 test to tell you that you should,
Just a
maybe
changed
try to eat more,
intervention. Yeah.
more diversity, try to improve your diet to help improve your microbiome? There's lots of things that you can do that we know can help with improving the microbiome profile that are low cost, or that you can fit into your everyday. Do you need to do a $800 test to tell you that? Or can you
Right.
save that money for groceries and all the other
A
stuff you have to do?
vacation where your
Yeah,
IBS will be so much better because you're relaxed.
yeah, exactly. Okay, we can talk about GI map all day, but we will move on. So the next one is the fecal elastase test.
Yeah, so we kind of touched on this, but
Yeah.
fecal elastase is a valid test, and it kind of loops back to GI map because they do fecal elastase.
Mm-hmm.
So fecal elastase is really a measure of elastase is an enzyme produced by your pancreas to help in digestion. And sometimes if you're experiencing symptoms of diarrhea, fat malabsorption, the doctor may order a fecal elastase to see how much of this elastase is in your stool.
Mm-hmm.
If it's low, it could mean that you have pancreatic exocrine insufficiency. So basically, your pancreas isn't producing enough enzymes to properly digest. And the concern with this is malnutrition. In really severe cases, you might have issues with fat-soluble vitamins, low levels of those, and then you might actually malabsorb nutrition, like macronutrients as well, especially with the volume of diarrhea some patients experience.
Mm-hmm.
So that test can be helpful in determining what further workup is needed, because usually pancreatic exocrine insufficiency is associated with other health conditions.
Mm-hmm.
Cystic fibrosis is the big one. Most people with cystic fibrosis will be diagnosed, at a very young age, but also diabetes, pancreatic cancer, chronic pancreatitis, structural abnormalities with your pancreas that you might have been born with, pancreativism. All of these things can contribute to pancreatic exocrine insufficiency. So they'll look into getting a proper diagnosis for you. What is the cause of your pancreas not producing enough enzyme? And then treat that plus typically enzyme replacement therapy.
Mm-hmm. Yeah. And even, in the case of IBS too, I'm sure you've seen it a lot, but someone may get diagnosed with diarrhea or dominant IBS or IBSD, which do, present with more loose stools, and then the symptoms of IBS like abdominal pain and bloating. But with exocrine pancreatic insufficiency, it can like mimic the symptoms of IBSD. So you do get a lot of like abdominal pain, like very frequent loose stool, difficulty like absorbing fat, so maybe more greasy stool, fatigue, which can overlap. So even in the case of someone's, been diagnosed with IBSD, or they think they have IBS, but it's not really getting better, even with like low FODMAP diet or sort of trying the, common IBS management strategies, then it could be helpful to test for it to rule it out, and then get the proper treatment for it.
Yeah, and it is a simple test. It is a relatively inexpensive test. And you're right, it should be looked at. I believe it's like, do you remember? I don't know the exact statistic, but it's quite a large portion of people with chronic diarrhea that have EPI or PEI. It's like
I'd have to look
maybe
back
10% or 5%. But I'd have to double check. But it's actually, it's not just like a minuscule amount of people with, undiagnosed chronic diarrhea. It's a pretty good chunk. So if your chronic diarrhea is not responding to standard intervention, then it should absolutely be considered. Yeah. And that's again where like Lee or I or other dietitians might advocate to your physician, because we spend more time with you typically than your physician.
Yeah.
So we can say, this is what's going on. This is why we think this test might be valuable.
And then the treatment for it is prescription strength digestive enzymes. So Creon is a common one here in Canada, which is not something you would typically give to like an IBS patient unless you suspected that they had EPI. But
sure. Yeah, you can't do over-the-counter enzymes. That's such a good point. I think a lot of people think they can just pick up any digestive enzyme blend they find in like the natural health section, but that's like, I was gonna make like a silly reference, but like, yeah, it's such a small, minuscule dose of what you would need
Mm-hmm.
to overcome what your pancreas is not doing for you.
Yeah. It's
And
like
I'd like to
taking,
say, like, sometimes people take those over-the-counter enzymes and are like, I feel better. It doesn't mean you have exocrine pancreatic insufficiency.
mm-hmm.
It, lots of those enzymes contain like alpha galactosidase, which helps to break down galacto-oligosaccharides found in like beans and nuts and
Mm-hmm.
some grains, and or they contain lactase, or again, it ties back to the placebo effect. Doing something typically can help people feel better.
Yeah.
So yeah, we just want to be cautious in drawing conclusions. Your pancreas may be a-okay.
Yeah. And so back to the point about the GI map test, it does claim to test for fecal elastase, but you could always start with the one that you can do through your doctor, your medical team, which will cost a lot less and give you a more targeted um, result or investigation.
Mm-hmm.
So
Yeah,
cool.
I'm getting like a GI workup right now due to some issues. And I think fecal elastase was like $40 at a lab here in Mexico where I live,
Oh,
which I
okay.
assume is probably comparable in the US. Canada, you don't pay for your blood work anyways. So,
Yeah, yeah.
but it's so much less expensive on you, on the healthcare system,
Mm-hmm.
than doing JMAP.
Yeah,
So,
exactly.
cost
Yeah.
benefit.
Then the next test would be TTG IgA or celiac screening. So,
Yeah, so this
yeah.
is a blood test where we're measuring TTG IgA, which is a antibody that's produced by those with celiac disease
Mm-hmm.
as a result of inappropriate immune response or an autoimmune response to the protein found in wheat, barley, and rye, which is gluten. Gluten is a protein. And so what's important about this test is you actually have to have consumed wheat for the test to have validity. So it's a really important part of working out any sort of GI diagnoses. If you're experiencing things like diarrhea, bloating, even constipation, fatigue, ruling out celiac disease should be like, the very first step
Mm-hmm.
that people take. A good chunk of celiac disease is asymptomatic. So you might not have intestinal symptoms. You might have extraintestinal symptoms like fatigue, like vitamin deficiencies that are unexplained, low iron. And so celiac screen is really important.
Mm-hmm. Yeah.
That being said, it's the first step in diagnosing celiac disease. Its sensitivity or ability to accurately diagnose people with celiac disease isn't 100%.
Mm-hmm.
So, a follow up, if your symptoms require further follow up, would be a biopsy
Mm-hmm.
as the gold standard.
Yeah. I think previously here I know in Ontario, we had to pay for the celiac blood testing. But I
Hmm.
think maybe as of 2 years ago, um, well, they started with like a pilot project to make it free, and then I think they've continued it. So now people don't have to pay for the celiac testing if they meet the criteria, which I think before was a little bit of a deterrent. It was like $100, and some people didn't want to pay for it. But
Right.
even in the case of IBS or determining if you have IBS, it is important to rule out celiac disease first because a lot of the symptoms can overlap. And then if you want to, with IBS, maybe try a lower FODMAP diet, or some people do want to try gluten-free. It's much better to rule out celiac first while you're still eating gluten before you go
Mm-hmm.
to cut it out, because it can be difficult then to add it back in if you're feeling better but still having symptoms. So it is important to rule it out
100%.
initially. Yeah. And yeah, I was reading on the, I think it was Celiac Canada website, but the typical symptoms are the diarrhea, pain, weight loss. However, they now say like a lot of patients can present with atypical symptoms. So anemia is one, osteoporosis, oral ulcers, constipation. So not just diarrhea, but not having bowel movements as well, infertility, and neurological problems. So a lot of symptoms, but it can
Mm-hmm.
present in different ways. So it is important to rule it out. Exactly. And then let's get into the last test. So the hydrogen and methane breath test. What are your thoughts
Yeah.
on this one?
This one is like a use judiciously test. So, hydrogen and methane breath testing measures hydrogen and methane that you expire or breathe out when you're given a specific substrate. So, we use lactulose or glucose. You consume that, and then it allows you consume that like fasted, not eating, and then your microbes go to work and break that down. But you shouldn't have too many microbes high up in your intestine, in your small bowel, and you should have lots of microbes to digest that substrate in your colon. And so this test is used to diagnose small intestinal bacterial overgrowth or intestinal methanogenic overgrowth. Really, the only way your body can produce hydrogen or methane is through microbes. So it's like a direct measurement. It's not like you're producing hydrogen and methane any other way. So it's a very direct test. The problem with this test is that the sensitivity and specificity, meaning ability to positively or accurately diagnose someone who's positive or rule out somebody who's actually negative, is less than perfect for so many reasons, in particular how quickly your GI tract moves, and how your body absorbs the substrate if you're using glucose, because your body will absorb it. So it's not a perfect test. However, it can be a really helpful test in determining who is best going to respond to antibiotics. So if you have a positive hydrogen and methane breath test, you're more likely to adequately respond or have an improvement with antibiotic treatment for that SIBO or IMO. So as dietitians here, but a lot of people might not know this, is rifaximin is an antibiotic that's approved for treating irritable bowel syndrome diarrhea. It's also the antibiotic we use to treat SIBO. However, people with IBS-D who haven't had a hydrogen and methane breath test, it doesn't work all of the time and sometimes needs multiple rounds. People with a hydrogen and methane breath test that's positive, they're more likely to respond to that rifaximin. So I like hydrogen and methane breath testing if I have a patient who has irritable bowel syndrome overlapped with what I think is SIBO, to better determine who is going to best respond to antibiotics, because they're expensive, they're hard to access, and it really validates, the potential use of those antibiotics when other options for IBS management have failed.
Yeah. And I know I've seen, I think it's similar to the GI map test, but it's recommended a lot online, in the online gut health space. I think I don't know if I've seen as many posts about it, but I think a couple years ago, SIBO was getting a lot of attention, and there were a lot of posts saying like at least 50% or 50 to 80% of people with IBS have SIBO. So you should be tested for it and you should be treating it, which is not necessarily true. I mean, even now we know there's two different types of SIBO. So there's SIBO, which is small intestinal bacterial overgrowth, which refers to having more bacteria in your small bowel, which technically most of our microbiome is housed in our large bowel. We shouldn't have much microbes in our small bowel. So if there are more microbes there, it can cause issues. And then in the case of intestinal methanogen overgrowth, that's a growth of not a bacteria, but a microbe known as methanogens, which can occur throughout both the large and small bowel. So two types, which can present in different symptoms, diarrhea, constipation, etc. But to your point that it may lack in specificity and sensitivity, it might not be the best test to just jump to if you're having IBS symptoms. It might be good to maybe trial, some of the strategies for IBS first and see how you respond, and then working with your medical team based on, looking at your clinical symptoms and how you're responding, then maybe considering doing the test. So not something that we always want to jump.
I totally agree, because it's not a perfect test. So in the context of, really thinking about what the trajectory will look like for a patient who has a positive test, it's hard, it's expensive, it's, we don't want to unnecessarily recommend antibiotics. we want to make sure that our intervention actually has impact, especially when that intervention holds risk. So because the test isn't perfect, that's why I always try to manage those symptoms prior to jumping to hydrogen and methane breath testing, as opposed to, like you said, that like first line approach. Because the test is, so for example, TTG IgA that we just talked about has a sensitivity and specificity in the high 90s, meaning that like very few people are wrongly diagnosed or missed. Hydrogen and methane breath testing is like, depends on what study you look at, but it can range like, 40 to 60% sensitivity, meaning we're missing the other 40 to 60%. And then the specificity can be quite high, actually. So we're not wrongly diagnosing people, but it's still not, high 90s. It's, 80s. So you don't want to be wrongly diagnosed either.
Yeah, exactly. And similar to the celiac testing, where you need to be eating gluten for a period of time before to get the right results, with the hydrogen methane breath testing, like there's certain supplements you have to stop beforehand, and then the day before you're supposed to essentially do like a low fiber, very bland diet, and then fast for at least 12 hours before. So even just how well you actually committed and implemented the prep for it can influence the results too. And I think the other factor too is also constipation. Like if someone is backed up and there's stool backed up, that can actually muddy the results too. So different things could be going on. And then the access of it is difficult too. Like, and there's one private clinic here in Toronto that I sometimes have people get their doctor to refer them to, but there's not a lot of options for like in lab testing. Versus there are like home tests that you could order, but it's similar with the GI map test that like it's harder to control things when you're doing it at home, and that can impact the results too. So it's, while you said it could be, helpful in certain cases, there's definitely things that aren't perfect with it all around,
sure.
Unfortunately. But
access is hard. And most importantly, like we need a doctor to diagnose and treat when we're, thinking about using these tests. Otherwise it's for naught. So, we want to make sure we have a physician on board that understands SIBO and IMO and is willing to provide an intervention based on the results too.
Exactly. Yeah. Just to the point about responding to antibiotics, I know more recently there was a study that came out looking at the elemental diet. So is that similar as well? Using the breath tests can help us predict who will respond better to an elemental diet for SIBO?
I assume so. So this study was interesting in that a good chunk of the participants, this wasn't like their first time being diagnosed with SIBO or IMO. They might have failed antibiotics, or they might have had 2 rounds of it. It wasn't really disclosed. Like, did they not respond to antibiotics? Did they relapse? Have they done a couple rounds? Like, it was very unclear. But what was interesting is it had a very good response rate, where people had a negative test after doing elemental diet. So an elemental diet is really drinking formula, kind of like, you think of it kind of like Ensure, but it's completely broken down, meaning it's not going to be accessible to microbes. After it hits your stomach, it's going to be rapidly absorbed higher up in the small bowel. So those microbes essentially get starved out, and then there's a few other mechanisms in which it might improve your bowel symptoms. And you do this for 2 weeks. So no food, just this elemental diet for 2 weeks. And I think it was about 80% of people had a positive response where they ended up having a negative hydrogen and methane breath test post, especially those with just hydrogen. They were very good responders. Methanogens are way harder to treat and manage. So the methanogen group kind of stuck around or had more likely not gone into remission. All patients reported really great symptom response, which is great. And they were measuring, in the people that had methane positive tests, they were measuring like daily methane levels in both breath, So I'm pretending to hold like a little breath tube because it's,
Mm-hmm.
cute. Or also in the stool as well. So the methanogens in the stool dropped. So I'm excited about this because it provides people an alternative option that doesn't rely on antibiotics. I think the perception from physicians will be safer or higher safety profile.
Mm-hmm.
But it's expensive and psychologically it's really hard to do.
Yeah.
Not consuming food for 2 weeks, just formula.
Yeah, definitely.
So that's kind of the tricky part. Most of my patients that have done elemental diets seem to handle it well for the first, but if they have recurrent SIBO, they're like, I don't think I can do that again. That was so hard.
Yeah.
So yeah.
Depending on how severe the symptoms are, it's like with other things, sometimes we're willing to try more to feel better. But yeah, it is quite expensive. I think the M-Biota one, which is the one that was in the study that you're referencing, I think it's $750 US for 2 weeks.
Yeah, we created a little chart actually of all the elemental formulas on the market and then the price, so that people understood. So that's available on Ignite Nutrition if you Google PD, palatable elemental diet, and then it's also available on Gut Ed for dietitians as well.
Cool.
So we put it in both places so that people could utilize it with their patients to determine, because that's a lot of money.
Yes.
A lot of money. So
it is. Cool. So we'll recap our test options. So I put in the underrated category: fecal elastase, TTG, IgA, or celiac screen. And then I added hydrogen methane breath test because I feel like, although it's been talked about a lot, I think it's still underrated from the aspect of what it can help with, although it's not a perfect test. Would you
feel
agree?
like it's underrated in conventional medicine and overrated in more of an alternative medicine space. So we just gotta
that's
be more judicious.
Okay. It's a little bit of both. True. And then overrated, definitely GI map and the IgG testing. Yeah. Overrated, and
we agree. We're in agreement.
Good. Okay. No arguments today over these tests. Cool. Okay, well, we definitely talked through a lot. I think each one of these tests could have been an episode on its own, but that's all good.
Right.
Always come back to it. Anything else you want to add to the conversation?
I think, most of these things actually, if people are looking for more information, I think we have blog posts on every single one of these tests or the diagnoses associated with these tests on ignitenutrition.ca.
Cool.
So lots of good resources there. And for dietitians, either, obviously Lee has great stuff on her podcast. I also have a podcast called Let's Get Real. It hasn't been running in a while, but the episodes are still relevant and good. And then gut-ed.com for dietitians as well. Both free and paid continuing education there. So enjoy.
Yeah. So I will link to those in the show notes. And then I guess if someone wants to get in touch with you, you don't currently do counseling anymore.
I don't. My team does. I have an amazing team, and you can find them at ignitenutrition.ca.
Cool. And they're Canada-wide.
Yeah.
Cool.
There's a couple provinces we don't practice in, Quebec and Manitoba, but we're everywhere else.
Cool. Okay. Awesome. Well, thanks, Andrea. This is a great discussion. If anyone is listening and has any thoughts, comments, even their own experiences, you can pop them below. And I'm sure there'll be some light bulb moments for our listeners today.
Yeah. Thank you for having me.
Yeah. Okay, cool. Have a great rest of the day.
You too.